Hello, I hope you're doing well today. Today I want to cover 5 healthcare options for people who are planning to retire early. Now, maybe not all these options are available to you, but these are 5 options that I am aware of that may be available to people who are retiring prior to the age of 65 and becoming eligible for Medicare. And at the end, I will talk about the option I chose for my family and why. Option number 1, the Affordable Care Act, also known as ACA or Obamacare Marketplace. One of the nice advantages of going through the ACA Marketplace is that based upon your amount of income that you earn throughout the year, you may qualify for tax credits that reduces the cost of your monthly premiums. Now, there is a bit of a calculation that has to be done and a guesstimate of your modified adjusted gross income, which is your adjusted gross income, plus adding in a few items that have been deducted, such as IRA contributions, student loan interest, things of that nature. The plans are typically standardized into different metals, gold, silver, platinum, that correspond to different options, coverage amounts, deductibles, things that you would expect to find in different, as you're considering healthcare coverage options. One disadvantage is it is state specific, so you will need to go to healthcare.gov and do a search based upon your own zip code to see what options are available for you and what those costs look like. It would also limit your coverage to the state that you live in. Option number 2, healthcare sharing programs. These will typically be faith-based, so you will need to look at each individual program and see what sort of requirements they have for membership and what medical procedures they will and will not cover. One disadvantage is they typically do not cover pre-existing conditions. So again, you would need to look at the specific details of the different programs you consider. They are typically very affordable compared to other options, so something to keep in mind. Option number 3, going directly to a private healthcare carrier. This would be where you would go directly to an insurance provider that provides coverage in your area and seeing what sort of options they have available. You will typically find more freedom and flexibility in the coverage amounts and options available than you would find in the Affordable Care Act marketplace. However, these programs are typically going to be more expensive as well. Option number 4, if you are going to be leaving an employer that you currently get healthcare coverage through, in some cases they will continue to allow you to stay on that healthcare coverage, which is nice. That way you know what you're going to get and can feel good about keeping your existing coverage and the doctors you go to, things of that nature. However, it will also be more expensive because the employer will not be covering a portion of that cost anymore. And then option number 5, the COBRA program. Again, if you're leaving an existing employer, they're required to offer healthcare coverage for you to continue for a few years after you leave that employer. The nice thing is you could hold off on applying to that program, and then if you have a serious health condition, you can retroactively apply for COBRA coverage and get that healthcare event covered. However, again, it is typically a very expensive option to go with COBRA. So there you have it, 5 different healthcare coverage options that may be available to you. As for me and my family, we decided to go with the Affordable Care Act Marketplace. We found a plan inside there that was reasonably priced, and I'm keeping my income relatively low, so we do qualify for tax credits to offset some of our costs of our monthly premiums. And so we found that was the best option available for us. We did think about the healthcare sharing programs, but since we have some pre-existing conditions, those options were really not available for us. Also, I did find an independent insurance broker to work with to help me sort through options, answer my questions, and they actually applied to that healthcare coverage on my behalf, and it was free to me. They are paid by the insurance carrier directly, and so they are my first phone call if I have questions or issues. And it was a really nice experience. I do recommend them. Their name is Move Health, and I will leave a link in the description if you'd like to go check them out. Early retirees is one of the groups of people that they work with, along with people enrolling in Medicare and families and individuals. Again, I do not get any referral fee or anything like that. I just had a really good experience with them, and so if you feel like you need some help in sorting through all the different options available to you, then I recommend them to you. So, but if not, you could pursue any and all of these options on your own. So there you have it. I'm curious, if you're an early retiree, leave a comment. What health coverage option did you choose and why? Or if you're looking to retire early, what options are you considering, or do you like the sound of? I'd be interested in finding out. If you found this useful, I ask that you would consider liking the video, subscribing to the channel, and leaving a comment. I really appreciate it. Take care.